Africa region are increasingly experiencing intersecting public health emergencies, climate change-related disasters, and conflicts. This demands a renewed focus on bolstering preparedness and building resilience in the health systems and communities. This year alone, 7 of the 9 African region countries worst impacted by cholera outbreaks were in the SADC region. For Mpox, SADC is home to 4 of the 17 countries currently affected, with the Democratic Republic of the Congo at the epicenter of the epidemic and resurgence.
The grim reality that is facing the Southern African region. A joint meeting for SADC health ministers has been convened in Harare to seek solutions to these emerging threats. But the region still grapples with the HIV/AIDS pandemic. According to statistics, over 25 million people were living with HIV in the African region in 2022, with 20.8 million of these living in East and Southern Africa.
There are still 13 million people living with HIV in the SADC region. About 84% is what we've achieved in terms of treatment coverage, and about 94% of these are virally suppressed. So we are doing well, and this is remarkable progress. But let us not confuse progress with victory, with success, with ending AIDS. 260,000 AIDS deaths last year alone is one death too many. And I know each of you know in your countries how many deaths there have been. The AIDS response stands at a crossroads. It is a difficult time for us to be confronting these issues and looking to end AIDS as a public health threat.
Despite the notable progress in the HIV response for the SADC region, the number of new infections continues to be high, particularly among adolescent girls and young women. High levels of poverty has been cited as the leading cause.
And it is not because she's a badly behaved girl, but it is because of the levels of poverty and the vulnerability that are driving the decisions that she's making that are transactional. We heard that in the south of Madagascar, where there is currently a drought and where there is high levels of malnutrition, speaking of the levels of stunting, this is a country that is suffering significantly from this. We were told a story of how, for girls, the transaction of sex is valued right now at merely one tomato. 1 tomato in exchange for sex. If that's protected sex, for unprotected sex, it is 3 tomatoes. I know it sounds ridiculous. I know it sounds unbelievable, but these are real stories.
The meeting will also review the status of implementation of the decisions from the previous meetings and overall state of health in the SADC region. Khumalo, SABC News.